Hello and welcome. I'm Jessica Cherry, host of the ReImagination Café Podcast, and this is a special supplement to our podcast episode number 14, Cultivating Change, the Transformative Power of Care Farming. So often when we produce podcast episodes, in addition to having conversations with our primary guests, in this case, Kate Mudge, co-director of the Care Farming Network, and Woody Woodruff, founder of Red Wiggler Care Farm in Maryland, as part of my research, I have conversations with other people who can help me increase my understanding of the topic we're covering. That allows me to ask better questions and ultimately to create a better podcast. And oftentimes I incorporate those conversations into the episode. So in this case, to enable me to bring the care farming concept to life for my listeners, I felt it was really important to talk to various people who are running care farm programs. And so in that vein, Kate and Woody were kind enough to introduce me to Shawn Hayden, CEO of GAAMHA in Massachusetts, which does really a little bit of everything, it seems, when it comes to human services, including supporting people with substance use and mental health challenges. And one of the ways they help folks in recovery is through a care farming program. So I spoke with Shawn about this, and what was supposed to be a relatively short conversation turned into so much more. And while I was able to incorporate much of that conversation into the podcast episode, there was a lot that, due to timing constraints, got left out. So we've put together this supplemental track for anyone who wants to go deeper into Shawn's story, including how he entered GAAMHA's Pathway House in 2009 as a patient in recovery himself, rebuilt his life, and ultimately, in 2024, became GAAMHA CEO. Shawn also shares how his own background and experiences shape the lens through which he approaches his work today, as well as the happy accident that led GAAMHA to weave care farming into its substance use treatment program. So here's that full conversation, largely unedited, and I really hope you enjoy it. Shawn, thank you so much for joining me here at the ReImagination Café.
Hi, Jessica. Thank you so much for having me. Pleasure to be here.
So Shawn, before we get to how GAAMHA integrates care farming within its programming, to give our listeners some context, can you start by providing us with a general overview of GAAMHA and the key services you provide?
Sure. So GAAMHA is a multi-service human services organization that was founded in 1967. We used to have this really long name. It used to be the Gardner-Athol Area Mental Health Association, and that's a mouthful. So in the 90s, they legally truncated that to this terrible acronym of GAAMHA, but that is our legal name. And we say GAAMHA around here. We're located in north central Massachusetts, and we serve two core constituencies. The first and the largest tends to be our behavioral health services, and those are geared toward people with both substance use and or mental health challenges. We offer residential treatment, outpatient treatment, peer-driven services, supportive housing, a number of different things. We also have a suite of enrichment programs which are really designed for people with intellectual and or developmental disabilities. And typically those take the form of community-based day programs that are designed for people to either find employment or find some kind of social recreational activity that makes sure that they have a meaningful day. And we do a few other things too. We do human services transportation. We operate a social enterprise. So pretty comprehensive organization. And underneath each of those headings, there's different levels of care and types of services that we offer. Our mission at GAAMHA is to create a world where people can access help when they ask for it, no matter who they are. And that work is really driven by those core values that we really try to embody in everything we do, which are respect, humility, integrity, empathy, and persistence.
And where does care farming fit into GAAMHA's programs?
So care farming is one of several ways we approach recovery. We have multiple programs. Some are more traditional in their set and setting, but our care farming programs are a little bit newer, and they were sort of happy accidents. We didn't intend to start a care farm. I have no background traditionally in farming. I was kind of terrified of horses and cows, to be honest with you. But what happened was we leased a house because we needed to expand our supportive housing program. Didn't realize when we arrived that the house we're going to see was a farm. We just knew it had a bunch of bedrooms and bathrooms, which was kind of our criteria for congregate care. But when we took over the house, they asked if we could care for the goat and the pony that lived there. I think there was a couple of goats. And we still had no intention of going the farming route.
So what made you decide to establish a care farming program?
We noticed that the people who lived in the house, the ones who spent time with the animals and took up an interest in the farm, had better outcomes. And it was very anecdotal. It was just observational, like, hey, there's something going on here. These guys who are doing this are staying longer. Their outcomes are better. They have a better trajectory in their recovery. And that led to a period of exploration where myself and a colleague did a little bit of research on, are people using farming to help people get better? We really had no baseline information.
I understand why you said happy accident. You kind of stumbled on this.
I joke that I kind of Forrest Gumped my way into it. Just sort of happened. And what we found was really fascinating, right? We found out that this care farming concept had been around for centuries and that people were using it for a number of different populations to support them and help them heal and rehabilitate. But what we didn't find were a lot of care farms using that modality to support people with substance use disorder. So we were able to identify the other programs throughout New England, and we did a bunch of site visits and we learned some incredible information. But the two takeaways every time we went was either they didn't really do anything for people with substance use, or they were the exclusive domain of people with significant needs. So they either had high-end commercial PPO insurance plans, or they had private family funding to allow them to attend. And our agency really exclusively served people with low and no income.
And I know that through a lot of very out-of-the-box thinking, you were eventually able to license your farm as a substance use disorder treatment center. So that treatment is covered through Medicaid. No small feat, I'm sure, but you pulled it off. And what does your care farming program look like today?
So in 2020, we purchased this new property. In 2021, we opened this current version of the farm, which is called the Carl E. Dahl House at Evergreen Grove. It's a 16-bed licensed substance use treatment facility for men with co-occurring substance use and mental health conditions. And their care is 100% covered by Mass Health, which is our state Medicaid system. So no one pays $1 to attend treatment there. And the average length of stay is 6 to 12 months. So it's a really robust, long-term, at its core, it's a clinical treatment program, but it's in this really unique setting where we're able to weave our care farming modality into all of the clinical requirements that our state and Medicaid require to reimburse for this kind of care.
And that unique setting is a 115-acre equestrian estate where you now have a lot more than a pony and 2 goats. You now have goats, horses, pigs, chickens. I believe there was a donkey in one of the pictures I saw on your website. So residents have access to both a team of substance use professionals, and they also get to experience that sense of purpose that comes from taking care of these other living beings. So Shawn, you have a really powerful connection to GAAMHA, starting as a patient in recovery yourself at GAAMHA's Pathway House, which is a residential treatment program for adult men. Can you share a bit about your own story and how you ended up at Pathway House?
Yeah. So my life has been a series of ups and downs for sure. I started out my professional life right out of high school, and I had some success early on. I had a bit of an entrepreneurial spirit and did pretty well early in life. But in my early 20s, I had a back injury that led to a prescription for an opioid from a very well-intentioned family practitioner. And this was in the mid-90s. So people weren't really hip to what would be the opioid epidemic that was coming up. But as a young person, I certainly experimented, was probably on a trajectory to a substance issue, but it wasn't readily apparent. But when I tried opioids, it took hold very quickly. I remember the first time taking opioids, I felt like every problem I'd ever had been solved instantly. And it was a battle that I was able to hide in private for several years until it escalated to a point where I couldn't hide it any longer. And I went through several years of fighting the fight. I went on tour around the country to different rehab centers and programs. And my path was a familiar one where I started out at nice treatment centers on the beach in Florida. And by the end, it was public detoxes. And my last couple of detox episodes happened in a county jail cell. Mm-hmm. And so I had a pretty precipitous drop from that early promise.
And what made you decide to try Pathway House? And what was different about it?
When I entered GAAMHA's Pathway House, June 4th, 2009, I was really broken and defeated. But even then, bad as my life was, I was estranged from my wife and my young son. I didn't do it out of virtue. I did it because it was a better option than sitting in a county jail cell. And I didn't arrive with even a speck of confidence that I could get better. Because I'd really, at least in my mind, I had been trying to get better for a long time. But they were a little different than the other places I'd gone to. Never in my life had I been spoken to with such truth. And that particular program is an older program. And they have a way of delivering what you need to hear without any fanfare. They really don't try to dress it up for you. They're just brutally honest with you. And at that point in my life, that's exactly what I needed. I needed to be told what to do They have a lot of euphemisms that have grown out of that program. One of my favorites is do what you're told long enough so you can do what you're told without being told what to do. And that's
Oh, I
what
love that.
they're so good at it. They build this incredible, very rigid structure. They leave almost no room to deviate from that structure because they'll say, listen, you can go anywhere you want for help, but if you're going to attend this program, this is the way you're going to do it. And they have a method that works really well for a certain type of person. And fortunately for me, it was very serendipitous that when I arrived there, I think I was ready to be told what to do. I was so tired from trying to figure out how to get better. And I'd really kind of resigned myself that I was going to die from this disease. And it was baby steps. When you live that addicted lifestyle, it's amazing how removed you get from what for most people is a very normal way of living. But everything that you have to do to maintain that addictive lifestyle just counter to what most people think of their normal day being. So it was a lot of work, but through really no volition of my own, just following directions, my life got better. And that allowed me to sort of catch a fever for the process where I said, okay, these guys are onto something, even though I thought some of their rules were silly. And frankly, now that I'm behind the curtain, so to speak, they are, and they're intentionally silly, and they're meant to instill that humility and learn how to follow directions sort of thing. But that was really where I was able to start rebuilding my life. And eventually I was able to reconcile with my wife and my son and reunite our family, which for me, I'm incredibly blessed because that's not the typical outcome for people in my position. Most people aren't able to repair those relationships, or they don't get the opportunity to do that. But lo and behold, here we are 16 years later, and I have a beautiful life with my family. My wife, my son's 20 years old, and he's a great kid, and we have an incredible life together. But it all started there.
So, Shawn, first of all, thank you for sharing all of that. I am always so grateful when people share their stories with me and with our listeners. So really, really appreciate that. And as you said, many stories don't end as well as yours. So very happy about the way things have turned out for you. And of course, not only were you able to rebuild your life and repair your family relationships, but your experience at Pathway House opened up the door to a whole new career for you, where you could pay it forward and help others in recovery. So let's fast forward to 2024, when you're offered the job of a CEO of GAAMHA. And we've talked about what a surreal experience that was for you. But what I'm most curious about is, how does your background, your own experience with addiction and recovery, impact the way you approach your job today?
What an honor. What a privilege. I feel very, I don't know if protective is the right word, but I'm a fierce advocate for the people we serve. And I've been in their shoes. And the first lens I look through for anything related to this organization is that guy who walked into the Pathway House on June 4th, 2009, holding a garbage bag full of dirty clothes. That's the first guy who looks at every problem we have. And then I look through with my experience I've gained since then and the knowledge I've gained since then. But really, that's what I think about. If we're going to open a new program, offer a new service, I have to kind of go backwards and say, how would that person experience this? What's missing? What can we do better? What would motivate me back when I was that person? And I think that's invaluable. And I think it also gives me, obviously, a bit of credibility with the people we serve. People with addiction issues aren't typically a very trusting lot, right? They've had some pretty tough life experience, and they tend to be very guarded. So to be able to very quickly identify with them, have them understand that I understand. Doesn't mean I have all the answers, doesn't mean I had the same experience, but we have a base level understanding of what it feels like to be at the point I was where I didn't think I could get better.
So when you were in recovery back in 2009, there was no Care Firm program at GAAMHA. But thanks to the happy accident you described earlier, there is now. So looking through the lens of that person who walked into Pathway House with a garbage bag full of dirty clothes and went through that program very successfully, what additional benefit do you think the Care Firming program could have provided? And how does that inform your perspective today?
When I was going through Pathway House, at the time I was 32 years old. So I was an adult male. I was married. I had a young child. And I remember being in that program, and I had to go to my first social event as a person newly in recovery. I think I was maybe 3 or 4 months sober. And I had a weekend pass for the program. My parents were taking me to this big anniversary party. And I remember walking in there, and one, you're nervous because it's like a social drinking situation. So that's the concern. But my biggest concern was not that. My biggest concern was I'd encounter some distant cousin or someone I knew, and they were going to ask me the question we all ask each other when we first meet, which is, what do you do? And when you're 32 years old and someone asks you, what do you do? It's a really innocuous question. It's probably one of the first 3 or 4 questions you ask when you meet someone. When you're an adult and the answer is, I'm in a program, you feel about this big. you know, I know our listeners can't see that, but you feel as small as you can imagine.
Yeah.
Yeah. And I was terrified I would get that question because I didn't want to answer it. So the folks who attend our program, when they encounter that same scenario and someone says, what do you do? Their answer is, I work on a farm. I help care for rescued farm animals. I'm working with a group of endangered ponies that are on the brink of extinction to save their species from extinction. When people hear that, they go, whoa, tell me more. That's amazing. Tell me more about that. And now it has the opposite effect. Now I'm the talk of the town. Now people want to gather around me and hear about the work I do. So that's one big difference. I'd say the other one is, I think a lot of rehabilitation programs make a really significant mistake almost on day one. And I had this experience myself as I would go in and out of rehab programs, which is you arrive at this treatment center. There's a lot of paperwork. There's a lot of intake processes. Your head's all over the place because you're just coming off of your substance or whatever. And they all say the same thing. They say, Shawn, you need to learn how to love yourself, right? Which is a true statement, right? We should all learn how to love ourselves. But in that moment, I remember thinking, I just stole my grandmother's toaster like 2 weeks ago. I haven't talked to my son in 3 months. I haven't paid a bill in over a year. You want me to love myself? I'm not lovable, right? And in that moment, I don't know how lovable I was. We don't ask that question. All we do is we say, Jessica, welcome to the Dahl house. Here's what I need you to do. And we'll grab a baby goat or a pony and we'll say, I need you to love Lola. And Jessica goes, I think I can do that, you know? And then we just let you do that for a period of time. And we tell you how to care for your animal. We go through all the safety and health issues, and we'll let Jessica do that for 2, 3, 4, 5 weeks. And then we'll pause and we'll go, can we just review what just happened? You showed up here. You learned about this animal. You cared for it day and night. If it was winter, you got up in the middle of the night, went and broke up water and added extra hay to the stall. The animal's thriving in your care. Boy, that sounds pretty lovable, doesn't it?
Wow.
You were responsible. Yeah. You were accountable. You gave service to another living being. How do you feel about yourself now? You know, and at that point, people can go, maybe I have some value. Maybe there's something in me that's worth saving. So I think that's one of many examples. The other thing is that when a new person, we welcome to the farm, and we always start off with a tour, and we walk into the barn for the first time. And these people come in with some of them have really incredible history. We've had certainly people who have been criminal justice involved. They've been chronically homeless. We recently had a young man who was a refugee from Liberia, who was a child soldier. And they have these incredibly just dark and terrible backgrounds. When you walk into a barn, all of that disappears. Mm-hmm. Whatever you offer those animals in that moment is what they return back to you. They don't care about any of those things. And in a lot of times, that relationship you form with that animal is the most honest relationship you've had maybe in decades. Because when you're active in substance use, and I'll use myself as an example, when I would enter a room, I always felt like my addiction walked into the room about 10 seconds before I did. Because I looked the part, right? And I had a reputation I'd earned in my community. And everyone who interacted with me filtered that interaction through that information. So there was never really a genuine welcome. It was like, hey, I know Shawn. Here's Shawn. He's the guy with all the problems.
Right.
And the animals, they don't have that filter. It's the most honest relationship you can have. And that can be so profound for someone. I mean, the bonds the guys form with the animals happen so quickly, and they're intense bonds, right? Because for the first time, they're just getting back what they give. And like I said, sometimes it's been so long since they've had that kind of interaction. It's really remarkable. And it teaches them that they can form relationships again.
And implicit in what you just said is the lack of judgment, right? It's part of the human condition that we judge each other. Whereas the animals, the only thing they judge you for is the present moment, right?
That's right. That's right. Yeah. And particularly when we talk about equines, I always joke they're like emotional mirrors, and they teach us so much. A big part of our program at the Dahl house is we have a couple of staff who are certified equine-assisted learning, and that's all groundwork with equines. And it's remarkable the lessons that they can teach with equines that are immediately transferable to their life and recovery. There's a lot of work there with nonverbal communication. Right? A lot of us, we're really detached from our affect. We don't have a good understanding of what we're putting out when we walk into a room or we encounter a new situation. A horse will tell you, if you're reserved, they're reserved. If you're scared, they're scared. If you're nervous, they are nervous, right? And a lot of us really, and I can say that for myself again, I went through life not really understanding how I affected people because I was really self-centered. That's kind of a hallmark of addiction and alcoholism, is that sort of self-centeredness. I thought about myself a lot. Not always in a selfish way, more like, God, what do these people think of me?
Right.
What's everyone else thinking? But I was so unaware of what I was putting out there. So we use our equines to really help people understand what they're putting out. And then we do a lot of work with teamwork. We have an exercise where our human will be blindfolded and they'll be tethered to an equine, and we'll put them through an obstacle course. And they've got to work with that equine who can't speak and doesn't talk, right? And they have to get the equine to lead them through this obstacle course. And the lessons they learn about teamwork and touch and communication, it's really remarkable.
Trust.
And trust is a huge part of it, right? I mean, I'm blindfolded and I've got to get through this obstacle without falling down. I always joke they're the best therapists we have, are these four-legged animals.
Well, I can certainly relate to that. Horses have definitely seen me through more ups and downs than I could possibly count. But Shawn, is there any particular story you can share that really stands out to you and that illustrates what a difference being with these animals and the bonds they form can make in someone's recovery?
So we had a gentleman enter the program right after we opened the new site, and this gentleman had been struggling for about 2 decades with his substance use. And what was interesting about him, he's a little different than our average patient profile in that he had never been to a residential program before. He'd been certainly to plenty of detox facilities, inpatient psychiatric. I think he had some criminal justice involvement. But we don't typically see what we call like treatment naive patients. Typically, we get people who have tried everything under the sun. I was one of those people. But he hadn't been inpatient residential before. And he arrived and he didn't have any experience working on a farm. So he had a lot of trepidation about whether this was going to be the right facility for him. And almost immediately, I remember we almost couldn't pull him out of the goat pen. He almost wanted to live out there with these goats. And if you know anything about goats, they're like really mischievous dogs. More
That's
fun.
right.
A little frustrating because they're on this constant mission to escape just to try to get back in. But that's living with goats. And this guy, he just thrived. It was like he found his tribe. And if you looked at our goat herd, there's about 8 different types of goats in there. It's like the island of misfit toys. And they're the goofiest animals you can imagine. But this guy was able to put his life back together. And he's been around about 2.5 years now. He works for us now, and he has full custody of his 3 children, has his own apartment, his own vehicle. And now he's actually one of what we call our human-animal interaction specialists. So now he leads new people in the program through those relationships with the animals and assigns tasks and chores and projects. And he's just been a resounding success and just an incredible story.
Love that. And is there anyone you can think of whose recovery has surprised you?
There was a gentleman who entered our Pathway Health program like I did several years ago and was in the state most of us are in, had been trying and not finding traction in recovery, and had young children he was estranged from and a wife he was estranged from, and was just on that, we jokingly call it like the last chance express. Like, we're the place people drop people off who aren't supposed to get better. And this guy was not supposed to get better. Like, the evidence was clear. This person's probably not likely to get better. And he had probably a similar experience to what I did, where something happened at that program where things started to click, and he slowly put his life back together, went on to supportive housing, like did it the way they laid it out for him, and was able to slowly reintegrate with his family and be present in his children's lives, and actually got a job eventually working here also. And he started out with a part-time maintenance job. And when we opened our farming program, he was working there. We were just building the place. So he's actually working in construction. And I remember having a conversation with him where he told me as a kid, I think it was a family member, an uncle or a grandfather had a farm. And he's like, yeah, I spent my whole childhood around horses, and things started to click, and he had an opportunity to come move from his facilities job into our care farming program as sort of a farmhand role. But quickly it was evident that he was going to be able to do more than that. And so he ended up being in a leadership role at the farm. And then I think he had several years of recovery, 6-7 years of recovery. And then a couple of years ago, he found out that this beautiful family that he has, his wife, was diagnosed with stage 4 cancer. And it was pretty incredible to see him, sorry, I get choked up, not only navigate that situation and all that comes with that, but to see the entire organization rally around him, just in so many ways. His coworkers, many of whom were similar paths, where they had gotten better with this organization and came to work here, holding fundraisers, donating their PTO, all the things that really kept their family afloat. And sadly, he did lose his wife eventually to cancer, but to see somebody do that and stay sober to the process, and now is actually in a position to take over leadership of that program, is just, it's so humbling. I don't know how he did it. I mean, I don't know if I could be as strong as he was, but it's just incredible to think of what would have happened to those children if he didn't get better, all those things.
What a lovely example of the community you're building at the farm at Dahl House, where people are clearly taking care of both the animals and each other. Thank you for sharing that. So beyond the personal stories, and I know there are a lot of them, you've also done a lot of research to measure the impact of your Care Farm program. Can you talk a little bit about that, including what metrics you've used?
Yeah, so the research part was challenging because there weren't many peer programs to point to. So we didn't have a good baseline measure. There weren't a lot of peer programs, but what we did do is we're able to measure against more traditional programming. And some of the metrics we really like to look at are things like program completion is a pretty important metric. In Massachusetts, long-term treatment programs, people complete generally, it changes year over year, but between 28 and 32% is about the annual average. And right now, I believe our Care Farm is about 43%. So it's not where we want it to be, but it's much higher. I think a better metric, because recovery, it's not a real black and white metric in and of itself, because people define recovery in different ways. And this is a chronic relapsing disease in many ways. So length of stay, I think, is a really important metric. Do people stay in program? And our average length of stay is in excess of 6 months, which is far beyond state averages for traditional programming, because that continuity of care piece, right? That's what I'm always thinking about. And are they stepping down to another level of care? But more importantly, I think some of the best things we've done is invite independent third parties to come in and conduct their own research, because I want to focus on service delivery. I want their data, right? Because it can inform the service delivery. I don't want to be a researcher. I want us to worry about delivering care day in, day out. So we've invited third parties to come in. We had a PhD student from Liberty University come in and conduct a study. And it was a qualitative study, because it's hard to do a quantitative study with care farming. It can be done. I think for the purposes of his project, he wanted to go that route. And what it showed was the overwhelming enthusiasm and really interesting outcomes for the people who attend our program, that it was better and more effective. And most of them had extensive experience with traditional programming, that the connection with the animals changed their lives, that the commitment to something other than themselves was really the key difference in helping them gather that enthusiasm for the recovery process. And then we actually had an interesting study done, and I didn't anticipate this, but we had a veterinary student from Penn come in and study the health of our goats, and was able to show that our goats' physical health improved by participating in our program with our humans.
Oh my goodness.
Yeah, it's pretty fascinating. And that was a really hard study design too, because we had to have control groups in different settings, but they showed that the goats actually expressed choice in participating in the activities with our people versus having free time, right? They could just go about freely. So it was good to see that there was a mutual benefit there. So the goal is to really invite more people in to help us study this, people whose expertise is research. We're more of a provider expert than a research expert, but we have an internal electronic health record, and we're always gathering data, because the more data we have, we can hopefully use that as the tool to help the development team gather philanthropic dollars to help support the program.
Of course, so important. So Shawn, let's pivot a little bit. And can you tell us what role the Care Farming Network has played in Dahl House's success? And why is it so important to be part of a network of care farmers?
I can't overstate how important being a part of the Care Farming Network is, really, because I think if you talk to any care farming provider, and I know this because we had our first national conference last year, and we all from all over the country get together in a room, and it was amazing to hear everyone tell the same story. I think anyone who gets into this, their passion drives them into the work, and probably they've seen some indicators that the work is going to be impactful, but everyone feels alone. Before the Care Farming Network, there's really no coalescing body to pull all these folks together to develop best practices and share resources and learn from one another. And that's the part that's been incredibly important, because we're experts in substance use treatment and mental health support and different things. We're not expert farmers. I mean, we're probably more expert than we were 7 or 8 years ago, but the connections we form, and then you find out, oh my gosh, there's another one. They're only a couple hours away. We can visit each other, and that piece of it. And I think just validation from one another that the struggle is universal in some of these things. And we've all made enough mistakes and bumped our head enough times that as new care farmers come into the fold, we can say, okay, here's what we're going to tell you before you even get started. Don't do X, Y, Z. Definitely do this over here, and spare them some of the heartburn that maybe some of us experience as we were breaking the mold, so to speak. And I think the future for the work is really exciting. Now there's a real spotlight on this. I think for a time, this work was seen as kind of a cutesy, hokey, woo-woo kind of approach. But I think there's enough data coming out now to say, no, this is an impactful and valid service delivery modality that can be applied to multiple populations. And we learn from our partner farms who work with people with developmental disabilities and people who work with psychiatry, reentry, whatever it may be. This approach works for people. And to me, it's just important. One of the things I learned in our traditional programming is that no two people are the same. Not everyone recovers the same way. And in traditional treatment, it often mirrors almost a high school model where you get up in the morning, you attend a group, you move down the hall, you attend the next group, you move down the hall, you attend the next group. And then if you poll our people and ask them, what was your school experience like? The vast majority will tell you they didn't have a positive school experience. And then we're going to ask them to go back to that environment and heal. Doesn't make sense, right? So with care farming, people have freedom of movement. They have sunshine. They have the physicality of the farming process. It's just so much more conducive for kinesthetic learners, people who don't want to be stuck in a chair. They have boundless energy. It just makes all the sense in the world. And the Care Farming Network is really that coalescing body that brings all these incredible people together to learn from each other, to help each other get better and share resources. And it's just so important that they're there. And we're just so thrilled to be a part of the network.
Well, and Shawn, I know from my conversation with Kate, just what an important role you play within CFN. And of course, I know they're very grateful for that. Okay, so Shawn, we are out of time. But before I let you go, how can people find out more about GAAMHA and your care farming program?
I think the best place to start is our website, which is www.GAAMHA.org. And for people who are on social media, if they want to follow our care farm on Facebook and Instagram, it's the Carl E. Dahl House, DAHL. You can find us on social media, and there's posts every day about what's going on at the farm, and it's a fun follow.
Thank you so much, Shawn. You've done a terrific job of really bringing to life why these care farming programs are so important and just what an impact they can have. Really, really appreciate you joining me here at the ReImagination Café.
Thanks, Jessica. It was my pleasure.